Is communication regression always a sign of a developmental delay? Imagine a child who was talking clearly last month but suddenly stops speaking or loses words they once knew. Does that mean something serious is happening? Not always. Sometimes, regression in communication can be caused by different factors, and understanding these can help us figure out what's really going on. Communication regression means losing skills in speaking or understanding language that the child previously had. It might seem alarming, but it does not always point to a developmental delay. For example, children with autism spectrum disorder often experience regression, usually between 15 and 30 months of age. But not all children with autism lose language skills. When regression happens in autism, it might also involve social skills or motor movements, and sometimes children catch up with help over time. Hearing problems are another cause. If a child has frequent ear infections, they might struggle to hear sounds clearly. This can make it seem like they are losing speech skills, but it's really a sensory issue, not a delay in development. Once the hearing problem is treated, speech often improves. Environmental factors can also influence communication skills. For example, children learning two languages may go through a period where they seem to lose words or pause more often. This is called a silent period and is normal during bilingual development. It's not a delay but a temporary adjustment as they learn to switch between languages. Other medical conditions, like childhood dementia or certain genetic syndromes, can cause regression. These are less common but important to consider. When speech therapists or doctors see regression, they start by doing a full assessment. They check if the child's understanding of language is affected, along with their ability to speak. They look at other areas like motor skills, social skills, and emotional health. This helps identify if the regression is due to a delay, sensory issues, or something else. Early intervention is key. Depending on what's causing the regression, children might need speech therapy, medical treatment, or behavioral support. The goal is to support their communication and overall development as early as possible. So, to answer the question directly, communication regression is a red flag that needs professional attention. But it isn't always a sign of a developmental delay. Sometimes it's temporary or caused by other factors. Recognizing the difference and acting early can make a big difference in helping children develop their communication skills successfully.